Great. Okay, well, good morning, everybody, and welcome to our May HIPC. You can see the agenda up on the screen. We're going to start with some partner announcements, receive a COVID-19 update, and then have a discussion about housing. So I will open the floor for partner announcements. And Jen, yep, go ahead.
Sure, I can share one. We're really pleased to be offering another CME in partnership with the Central California Alliance for Health, and Dale has been working with us. We're really excited to present improving healthcare outcomes by addressing access and equity through the lens of maternal and child health. And we have two fantastic speakers who are local to our county. Carmen Powell, who many of you know, is our medical director of the pediatric department at Watsonville Community Hospital. She's also a assistant clinical professor at Stanford. And then Christina Gamboa, OBGYN physician and director of ambulatory care at Salud para la Gente, Women's Health. And together they're going to, I think, provide a very, timely and important hour and a half, which of course provides CME for those of you who join us, addressing systemic and structural racism in medicine. They'll identify areas where racism affects care and will explore active allyship and accountability to promote health equity. So we really hope you'll join us. It'll be coming up April 16th, 7:30 in the morning, and we hope you'll join us. And there'll be some pre-work sent to you all to support all of our learning and terminology. And then, yeah, we're really excited that they'll be joining us. Thank you. We hope you'll take the time to do a deeper dive with some of our really excellent colleagues in Santa Cruz. Thank you much. And there will be a link, I think, in the chat, but also you'll be getting the flyer, which has an embedded link to register.
And there was one additional planned update around the annual forum.
Yes, good morning, buenos dias. Just wanted to take a few moments to remind folks that the HIP's upcoming annual forum, Juntos y Adelante, Advancing Recovery and Equity Beyond COVID-19, is just 2 weeks away. So on Thursday, May 27th from 11 to 12:30. This event is free and sponsored by the Hospital Council. So if you haven't registered, we will also be adding the registration link to the chat, and we invite you to spread the word. This year's keynote is Isabel Luron, and she will be joined by local experts in our community who have adopted a racial equity as central to their organization's mission and work. And HIP welcomes our one of our very own DeAndre James, Executive Director of the Community Health Trust of Pajaro Valley, as the forum moderator. And our guest panelists include Kat Willis, Executive Director of the Tannery World Dance and Cultural Center, our very own Jennifer Herrera, Chief of Public Health for the County of Santa Cruz Public Health Division, Maria Cadenas, Executive Director of Santa Cruz Community Health Ventures, and Steve McKay, Associate Professor of Sociology and Director of the Center for Labor Studies at the University of California, Santa Cruz. And again, this year's forum aims to re-energize our community around an equitable recovery plan as we emerge and yet continue to manage COVID-19. So I hope that you guys will join us.
Thank you.
Yeah.
Oh, go ahead.
Is Alex Threfall here, our Chief of Psychiatry?
Yeah, I'm here, Jen.
Do you want to do the PI announcement? I think I forwarded the flyer if Anais or Justin can put that up. Thank you.
Oh.
There we go.
Well, that's just, thank you for doing that. I was thinking, oh, I really missed the boat on this. I did last time. So thank you very much for putting this up. So
Sure.
Want to make sure that folks are aware and have it on their radar that next week we're having our process improvement event for the SOAR2 system of care for MAT treatments. It's sort of a mouthful, but basically we're going to be covering the system of care as it relates to medication-assisted treatment, And Jen, do you want to put in the plug for a term for Matt that you would prefer to use rather than medication assisted treatment?
We'll go with that for now.
Okay, cool.
Yeah.
Anyway, so we've spent the last few weeks mapping our MAT services across the community, identifying where we are really strong and identifying gaps and barriers in coverage. And we really hope it'll be a dynamic event for people to learn a lot about what has already taken place with all the hard work that Jen and her team through SafeRx have been doing. And I think we have a bright future for our MAT services in our community as we identify the gaps and then work on closing those gaps and barriers. So please join us next week. As you can see, there's a link in the flyer, and CME will be available.
Great, thank you. DeAndre, I see your hand.
Yes, thanks, and thanks Sigilin and HIP for inviting me to that event. Two things for us at the Health Trust. If you haven't been out to our farmers market every Tuesday in Watsonville, and thanks Central Coast Alliance and Kaiser for the partnership and making that happen, please do come out. It's great to see the community get out and about now a little bit, and the farmers market was a definite need for South County. So please come out every Tuesday from 2 to 6, join us there. And then coming up in June, we have our health forum, and we're calling it Community Growth After COVID. And that will be in probably in June, on June 10th. It's for individuals, nonprofit, health agencies. And the hope is that you come away with a real-time assessment of a community's greatest need post-COVID, strategies to promote hope and healing, a framework that will help apply to individuals, and ideas utilizing partnerships. Our keynote speaker for that is our own Lori Butterworth. And so we're looking at June 10th, things to come out pretty soon to come to that and be a part of that. And so just a great event and another add to all the great events as we see that we're having here. So thank you.
Thanks, DeAndre. So we are at time on our agenda for partner check-ins. So perhaps if we have time at the end, if there's additional check-ins, we can pick them up there. But we're going to shift now, and Jen Herrera is going to share a COVID-19 update.
Great, thank you. I'm going to go ahead and share my screen. And I am joined this morning by Dr. Newell and Mimi. So if I'm sure they can help me answer questions at the end of this presentation. And also Mimi and Dr. Newell, feel free to chime in if there's anything to add throughout the presentation. Great, so I'm here to give you an update on COVID-19, and we always start with the global view. It's a reminder that COVID-19 is an ongoing pandemic. It is a global pandemic by definition, and there have been over 150 million cases worldwide. If for those of you who listened to a clinician resource call on Tuesday, Dr. Kaufman, one of our local infectious disease doctors, really was able to highlight, what's going on over in India, and it's just a sobering reminder that this is still an active disease. Here locally in California, these are metrics as of Tuesday. The state has a positivity rate of 1.2% and a case rate of 3.7. You can see here that the majority of the state is in the orange tier, with a few states now in yellow, yellow being the least restrictive of the blueprint for a safer economy. And if you look at the Bay Area, you'll see that there are actually a couple of Bay Area counties that moved into the yellow this past week. Here in Santa Cruz County, we met yellow criteria, but we weren't quite eligible to move into the yellow tier. So we are still in orange. Potentially, if we keep up with this criteria, we will be able to move into the yellow tier next week. So our case rate as of Tuesday is 1.5. That's our adjusted case rate. our positivity rate is 0.5, and our health equity quartile positivity rate is 0.8. So again, these are metrics that actually meet yellow tier criteria, but we won't be eligible to move into the yellow tier until next week, assuming that we're able to keep our metrics in this range. And I want to highlight a bit more on the health equity metric. So this is the metric that measures the test positivity rate in the communities that have less, excuse me, that are most disproportionately impacted due to social determinants of health, which is primarily the South County region, and then a few pockets of neighborhoods in North County. And it measures the positivity rates in those neighborhoods against the positivity rate countywide. And the idea is to that we want to see a minimal gap between those two rates. And over time, for the past 30 days, we've been able to continue to see a general decreasing of that gap. And it's been amazing to see this actually over the period of the past few months, because it continues to decrease together, and also these two rates continue to narrow, which just shows that, you know, it's a way to measure health equity to ensure that the communities most impacted by COVID here in Santa Cruz, which is really South County, that their test positivity rate hasn't skyrocketed much more than the countywide positivity rate. And here's our dashboard. This was updated as of yesterday afternoon. We have 16,249 total known cases of COVID-19 and 91 active known cases. This is actually a pretty big milestone for us. We haven't been under 100 active known cases for many, many months, probably since before the surge. So that's amazing to be under 100 active known cases. And we have had 205 deaths due to COVID-19 on our dashboard. I think as of today, it will increase to 206. But another milestone is that we have no deaths under review in the queue right now. So every death that gets reported to us in public health, we don't post it right away. We have to do a vetting process to make sure that it actually meets criteria to count as a COVID-19 related death. And this is also the first time that we don't actually have any in the queue to review. So just indicative of the general slowdown of cases and of the pandemic here locally. So here, there's a lot of graphs here, but it's really just telling the same story. On the upper, get my pointer. So in this area over here, the top left is the average number of daily new COVID-19 cases in our county. You can see that it's continued to be low and stable. So it continues to be low, which then our death rate projections continue to actually be on a decline, as well as our hospitalization projections and our ICU projections. Okay, and then this is just our comparison chart to other counties. And you can see that we're on trend with everyone else. For the past few months, everyone's sort of been plateaued with their case rate. And I like this graph because it's our COVID-19 recovered population projection. So this really shows how we are more and more, we are getting less people who are susceptible to getting COVID-19 in our community for a couple of reasons. One is vaccinations, and then the other is getting immunity from a past infection. So this is good to see. And it's also, this is another way to see that story where our reproductive number has remained under 1, which shows that the virus is spreading pretty slowly here in our community. In terms of local response news, we have provided over 270,000 COVID-19 vaccines in Santa Cruz County, which is amazing that there's been that many vaccine doses administered here. We did have a local health officer order on face coverings that was rescinded when the state updated their face covering guidance to align with CDC. Locally, we are just deferring to the state's guidance. We no longer have a local health officer order for face coverings. We're also offering vaccines for homebound individuals. And the way that we are doing that is through a vaccine survey. And if people can't access that survey, then they can call Community Bridges, and they'll help. Community Bridges will actually take them, fill out the survey for them. And then pediatric vaccination, there's a lot of work in this area. We're planning on, planning is beginning now for summer clinics and back to school vaccinations. So diving into vaccines, all Californians 12 and up are eligible for vaccination. And to find a vaccine, they can contact their provider, or they could go to myturn.ca.gov to find available vaccine appointments that offer Pfizer, which right now is the only vaccine that's available for, excuse me, the younger population. People can also visit our local website, santacruzhealth.org/coronavirus vaccine, for additional local opportunities. So as I mentioned, we are preparing for pediatric vaccinations. There's a lot of movement this week on this particular topic. FDA approved Pfizer's use of the 12 and up population on the 10th, Monday. ACIP from CDC met yesterday, as well as Western states, and provided their approval. And CDPH did release a statement that all Californians 12 and up are eligible to receive a vaccine as of today. And I believe that there may actually be some of you who are providers have already started administering vaccines to the 12 and up population. Another change that was noted from ACIP yesterday is that COVID-19 and other vaccines may now be administered without regard to timing. Previously, there was a condition that vaccines couldn't be co-administered. So that is no longer the case. You can catch youth up on their vaccinations at the same time as getting a COVID-19 vaccine. So there's no contraindication there. Another strategy that we're working towards is aiming for a no wrong door approach for all of our vaccine clinics. And the way that we're doing this is we're offering a variety of vaccine choices at all of our public health-led clinics. We are allowing for walk-ins at most of our clinics, and we're allowing people to do their second doses with us, even if they didn't get their first doses with public health. I think a lot of other vaccine providers are doing the same sort of approach, since we do have enough supply to accommodate that. And really the idea is that we're trying as a community, I think we're all trying to make it as easy as possible for people to not just get vaccinated, but to be fully vaccinated for those who have to be on a 2-dose series. And then another strategy is that we are going to be sunsetting our mass vaccination public health-led clinic on 5/26 at the end of this month. And what we're doing is actually pivoting towards more of a targeted clinic format, or a pop-up clinic, and I'll talk a little bit more about that and towards the end of this presentation. So this is a screenshot of our internal vaccine dashboard. This isn't public, but I wanted to just give you a sense of what we're looking at here in public health when we're tracking our vaccine progress. This is just updated as of Monday. So this is an underestimate of where we're actually at with vaccine doses. On the state's website, I think we're at about 273,000 doses. But just to give you a sense of like how we're tracking total known individuals that are partially versus fully vaccinated. And we do have the majority of individuals who have been vaccinated are fully vaccinated in our county. If you look at this chart here, it shows the daily vaccines administered with a rolling 7-day average, which is this blue line. And we did have sort of an increase, and then we had a plateau when we were waiting for that surge of vaccine supply. we had a slight increase, and then we had the decline starting around like mid to late August. So the decline in demand for vaccine, and that's kind of considered that has continued to trend downward. But we're hopeful that with the recent allowance for the 12 and up population, that we'll be able to get more people interested in vaccines. Okay, and then this next slide, it's very busy, so I'm going to walk you through it. This is again just our internal dashboard, just to show you that we're looking at countywide all people who are all vaccinated, so partially and fully vaccinated, and just to show you some of the percentages that we're tracking. So in terms of gender, it's pretty much an even distribution from those identifying as female, male. I recognize that this is a binary. This is data that's taken from the CARE database. So we are restricted to seeing the fields that are in the database. In terms of the younger population, 16 to 19-year-olds, we are at 28% vaccinated in our community of those who are eligible. We don't have the younger population, the 12 and up, on here yet. I think we're still trying to figure out how we can get that accurate denominator. And the way that we're looking at our data here in public health is by a distribution that's by census tract to when we're looking at region. I'll get to that in a minute. But I just wanted to point that out. You know, it's pretty evenly around gender. We still have some ways to go with the younger population. And then I wanted to point out race and ethnicity because this data is publicly available on the state's website. But you can see here, like the other category, it's I think over 2,000% of population vaccinated. It's just showing that this metric, unfortunately, hasn't been entered very well in the CARE database, and it's something to be taken with a grain of salt when we're looking at race and ethnicity data by vaccination. Okay, and then we have it broken down by region. So again, we pull our data by census tract. On the state's dashboard, they pull it by zip code. So you may see some variations in numbers. Total vaccinations administered should be the same, but when we're looking at denominators by population, there's slight variations just based on how we're pulling the data. For total vaccines administered, we're seeing a pretty even distribution between North, Mid, and South County. And then we're seeing the same with in terms of fully vaccinated administered. And going into equity for a bit. So when we're looking at the distribution of vaccine administered in Santa Cruz County, again, we see it kind of evenly split. And for public health, because our role in the community is to really help fill gaps and ensure that we're equitable with the vaccine rollout in our community, a lot of our focus has been on South County. So you can see here on the chart that the public health doses, the majority of what we've administered have been to residents in the South County region. And when we look at this, this is on the state's dashboard. It's the vaccine equity metric where it looks at our community by social determinants of health. And so the blue neighborhoods or the blue regions are the regions that have less healthy community conditions. The green regions have more healthy community conditions. And what we typically see just traditionally in health is that those who have access to healthier conditions have healthier outcomes. And so what we are trying to do is have an even distribution of vaccine among the blue neighborhoods and the green neighborhoods. And so that's what we've been able to see here in Santa Cruz County. And we're starting to, you'll see here compared to California, California is seeing a higher distribution in the green areas and slightly lower in the blue areas, but they have been doing a lot of work to try to even that out as well. Oh, excuse me. This is another way to look at this data where you see the blue and the green lines correlate with these neighborhoods. And what we want to see is the blue and the green line really stay aligned so that we don't see those disparities between neighborhoods that typically don't have access to healthier conditions. And these healthier conditions are things like access to transportation, if they have access to medical care or insurance, the things that we're all kind of familiar with. And compared to California, there has been this gap, although everyone is trending upward in terms of being fully vaccinated. So just the last few slides, some vaccine outreach updates. So I did mention that we have our homebound vaccinations happening, and we do have our vaccine strike team that is going through those lists and actually doing vaccinations now off of those homebound surveys. The opt-and-serve location for over at Old City Hall in Watsonville is available to walk-ins now, and they offer Pfizer. So youth are going to be able to attend opt-and-serve if they want to get a vaccine there. It's open Thursday through Monday, 9 a.m. to 6 p.m. So appointment is always helpful, but it's not necessary. And we have some upcoming neighborhood-based or pop-up collaborations. We recently went to Pajaro Dunes Resort, where we offered Janssen & Janssen. This was a collaboration with La Gente, as well as the Live Oak Cradle to Career Promotora program. And from what we hear, it was a very successful event. What we did was the promotoras provided their personal stories about getting the vaccine and why they would get the vaccine. And then Salud was there and able to provide vaccines on site if the workers chose to do so. And I forgot to mention that this was for the workforce at Pajaro Dunes Resort. The employer actually reached out to us saying that there was some vaccine hesitancy among his staff and wanted to offer on paid time some education and vaccine availability opportunity for the staff. And so it sounds like it was pretty successful. At the fairgrounds, we're going to be out there with just a small number of doses, 50 Janssen's, on Sundays during the swap meet from 9 to noon. And we're giving out some incentives as well. We were there on Mother's Day and we gave out cookies and flowers. We didn't have as much of a turnout for people who were willing to get a vaccine, but we did a lot of outreach. And so we were able to do a lot of community one-on-one and community engagement. And I think Dory was actually out there with us. So thank you to Dory for working that clinic with us. And then Diversity Center, we're working with Santa Cruz. Our Santa Cruz Community Health Center is doing this clinic with Diversity Center. And then Davenport Resource Center, Sutter and Community Action Board is doing a clinic over in that region on May 23rd. And I think they intentionally chose a later date in May in order for families to go ahead and get vaccinated together. And then vaccine mapping session. So on this Friday, on May 14th, we're going to be facilitating a mapping session, which is an interactive discussion with a variety of health, social service, and community partners to review future pop-up clinic opportunities in the county. In pop-up clinics, what we're trying to accomplish is obviously increasing vaccine rates, promoting health equity, so identifying the communities that are disproportionately impacted by COVID or who don't have access to vaccines, and increasing community-wide vaccine confidence. And we're also assessing resources for these pop-ups. So the community partner organizations who can mobilize people and enroll populations to get vaccinated, and then healthcare agencies who are able to do a pop-up and actually do the vaccinations. So an example of this are what I mentioned in my previous slide, where Sutter is going to be doing vaccinations and CAB is actually mobilizing the community for this Davenport clinic. So who's invited? Health and community partners. So all of you are invited. And I should mention, I think I saw Erica Padilla Chavez on this call. Erica has been very gracious that we're actually going to be utilizing the South County Community Partner Triage meeting space, which is on Zoom this Friday, but we're really appreciative of that space to be able to get partners to be able to connect. So this, again, it's for community-based organizations, but also for healthcare partners. And some of you have already received this invite. And then lastly, we have our public health messages of wash your hands, wear a mask, keep your distance, stay home if you're sick, and of course, get vaccinated. So I'm going to stop sharing my screen, and we're happy to take some questions if we have time.
Thank you so much, Jen, for your leadership, to the public health team, HSA. We really appreciate these COVID-19 updates, very promising news. And we do not, unfortunately, have time for questions, but if any come our way, we will forward them on to your team. At this time, I'd like to move us forward to our housing-focused agenda. And I'll just say before we start that, first of all, this month is Affordable Housing Month. So we're celebrating appropriately by featuring Dr. Ratner and Don Lane. And I'll also mention that it was 5 years ago that HIP celebrated the kind of passing of the baton of our founder, Ellie Littman. And we also featured Housing is Health as our annual forum topic. So here we are, of course, still tackling this issue, but we've come a long way. And I believe that this new division within the Human Services Department focused on Housing as Health is an indication of true commitment, and also having Don Lane back with us here in this forum to talk about the advocacy that we need to move forward. Just it's exciting to be with you all, and I appreciate our speakers. Randy Morris, our director of the Human Services Department, is going to kick us off. Thank you, Randy.
Thank you, Elisa. Good morning, everyone. It's always humbling to follow our excellent public health colleagues. Great job, Jen, as always. So I just wanted to take a few minutes to say why County Human Services, especially here talking to HIPC, following County Health Services, given the title of this division, which you'll hear a lot about from Dr. Ratner, is Housing for Health. Years back, the county did not take on the issue of homelessness and housing challenges in the community as much as our newish county administrator, Carlos Palacios, has. And since Carlos became our CAO, he took it on, added resources, and always had a vision of shifting the county focus of moving it from the hub of the CAO into the safety net, which is jointly administered by County Health and County Human Services. I started in February of 2020, and the month before I started, Carlos made a decision well before the pandemic that he would leave it to the new Human Services Director guy here, Randy, and Mimi, my new colleague, the health director, to figure out who would administer this program. We both run safety net programs, we work in partnership, and this thing called the pandemic hit and a few other things, and Mimi and I made the decision that Human Service would administer it, and my department that I inherited, it was in very good standing thanks to the great work of Ellen Timberlake, my predecessor, former member here. The last thing I want to say before turning this over to Robert to give the presentation is it was very intentional in how we went through the hiring process to hire somebody as excellent as Robert, who comes from health and is a medical doctor and public health expert. And that includes, we had 2 hiring panels to go through this hiring process, had a very community hiring focus. Mimi was with me in the hiring manager panel and helped me think through who to hire. And then there was a community panel. And on the community panel, I worked with Carlos, I worked with Mimi, and we tried to identify how to engage HIP. I spoke to Elisa, if you remember Elisa, and we actually had 2 important members of this HIP group participate on the hiring panel. One is we had the local clinic, Salud with Dory. Thank you, Dory. I don't know if you're on today, but we also had, and Jen, I'm going to match your shout out to Erica Padilla Chavez because I see her on the call. Erica was also on the hiring panel. So I want to just, as way of introduction, make sure you know, though this program is administered in Human Services, though I on paper am Robert's supervisor, Robert comes from health, and Robert was truly a community hire in partnership with HIP. So with that said, I turn it over to you, Robert.
All right, thank you, Randy, and thank you, members of HIP, for allowing me to come and present during Affordable Housing Month. I'm really excited to be working here in Santa Cruz County and to partner with all of you, and I've had a chance to meet many of you, and I get to introduce Don when I'm done with my talking points, which is also exciting for me. So I'm gonna pull up my slide deck, and our plan is that I'm going to present my materials, and then Don will follow, and then we hope to have time for questions and comments and explore some opportunities for collaboration. So let me get this going. All right. Randy just alluded to it, but our Human Services Department within the County of Santa Cruz, we have a new division, and I was hired to be the director of that new division. And I'm excited about the name of our division, Housing for Health. So having a stable place to live and a home is really critical to health and well-being. My personal career path led me to this moment where in training for medical practice, I got really interested in population and public health, and discovered in safety net clinics and hospital settings that one of the most important issues that I was never really able to address was whether or not people had a stable place to return to home. So I had a fantasy somewhere in the middle of my 4th year of medical training that maybe one day I'd be able to write a prescription for housing. And I had a moment, I last worked in Alameda County, where we were able to actually take healthcare dollars, and as I was able to send an email approving someone for housing. So I was incredibly excited that that's possible, and it speaks to the need for us as healthcare folks to start shifting our time and resources to social determinants of health as much as possible if we're really about promoting health and well-being over the long run. So on here, I wanted to just, the 2 logos on the side, we're part of the Human Services Department. I don't think of us as a program per se. We are a small but mighty group of staff who are really working to bring people together to build a coalition to prevent and end homelessness in our community. And it will require partnership with all of you and others to really make that a reality. And we are also staffed to something that's been called the Homeless Action Partnership. So the federal government, particularly the Housing and Urban Development Department, requires communities like ours to establish something called a continuum of care. And the continuum of care is supposed to be a group of interested stakeholders who want to work together to end homelessness. And then you form a board that helps to make decisions about how we use data, how we coordinate our services, certain pots of money and how it gets allocated. So Don Lane has been involved with the Homeless Action Partnership for quite some time. And as one of the byproducts of the creation of the new division, we're looking at starting up a new format for how we govern our work together. We may ultimately change the name, but for now, our department and our staff are really supporting the Homeless Action Partnership. So many of you have seen this data. I just wanted to ground us on information on the extent of homelessness in our county. And this comes from research that's done collaboratively. A lot of volunteers are involved. Applied survey research based here in Santa Cruz helps coordinate these point in time counts throughout the state. The data here shows trends in the number of people experiencing homelessness. So that means people living in places not meant for people to sleep, in shelters and in transitional housing. So you can see that in Santa Cruz, the numbers have gone up and down. And in 2019, we had around 2,100 people experiencing homelessness, a little more than 1,400 households. The vast majority of people experiencing homelessness, over 70%, are folks who are unsheltered, and that's a byproduct of the number of shelters we have in our community. We've seen a big increase in our shelter capacity because of COVID-19, and we've gone from around 467 shelter units or beds to just a little bit over 1,000, with some of those sheltering sites for people who are needing to isolate or quarantine, living in overcrowded or unsafe living situations, but not necessarily homeless. Wanted to highlight the self-reported and underlying self-reported health conditions. You can see that about 40% of people who were surveyed who are experiencing homelessness reported having a disabling condition. And that means it's in their own minds of long-term in nature and impacts their ability to live independently. And I would say it also impacts their ability to engage in activities that help them earn or increase their income. So the more common health conditions, and this is true nationally, that people self-report are behavioral health conditions. They're disproportionately represented among the homeless population. But a lot of individuals experiencing homelessness have a complex array of multiple health conditions, and our healthcare systems are not well suited to serving people who have complex conditions. The mental health people say oh, you have a substance use problem, you should go over to the substance use. The substance use people say, oh, you've got diabetes, you got to go over to healthcare. So one of our challenges as healthcare providers is really to look at holistic care for people with complex social and healthcare needs. This breaks out subpopulation data. I wanted to highlight a few things that have come up a fair amount in my 6 months here in the county. One is that we're fairly close to being able to end homelessness among veterans. The federal government recently lifted up that we've kind of slacked off nationally on that effort. And so we're kind of doubling down here in Santa Cruz County to really focus on getting to something called functional zero for homelessness among veterans, meaning we have a system that can help a veteran who loses their housing get back into housing within 30 days. And we have all the other veterans in stable housing. The other group where we can make a fair amount of progress is with families. That's adult households with at least one child under 18. So we're going to really focus on those populations and bring systems together to model how we could do that work with other subpopulations. Wanted to also highlight that we have to do work around prevention if we're ultimately going to move toward ending homelessness in our community. We, because of our new division, have some new data analytical capability, and I appreciated that I was able to see this graph. I'm not sharing it because it's preliminary, but on a monthly basis, using data that's reflective of people experiencing homelessness coming in for services, we have about 3 or 3.5 people coming in for services for every one that we're able to get into housing. So that's the wrong formula if we want to end homelessness. And about 3/4 of the people who are coming and asking for help are losing housing in our county. So we've got to figure out, how do we do more prevention work so that we're not working with people after they've lost their housing. And you can see that there's a variety of different things that lead to people losing their housing over time. And the biggest one, which we'll get to in a second, is why do we have homelessness? Because our housing costs here are much greater than folks' incomes, particularly seniors and people with disabilities, young people, people living on fixed incomes. There's some data that indicates, which I'll get to a little bit later, people need to have more than $40 an hour jobs to afford housing here. And Stephen McKay from UC Santa Cruz, there was just an article in Lookout Santa Cruz, and called out the city of Santa Cruz as the most expensive small city in the country. And I think there's some data that indicates that. So we've really got to do something about the cost of housing and enable people to increase their incomes if we're really going to prevent and end homelessness. I think this audience is probably very interested in health challenges that impact people's ability to manage daily living things that we often can take for granted. Actually, getting and keeping housing is a fairly complex task, from being able to remember to pay your rent and manage your income coming in, to being able to keep your unit clean, to managing your relationships with your neighbors. So there's a lot of health issues that can impact people's ability to live independently. So we as healthcare providers need to really lean in and support people to get and keep housing. Another thing that can happen for folks is an absence or loss of connections. There's a slide I'll get to in a moment that shows people who end up homeless often are first living with others in doubled up or couch surfing situations. And then as support dwindles over time for a variety of reasons, often the stresses of living with very limited incomes and other things happening in one's life, as those connections dissipate, people are more likely to end up on our streets or in our shelters. And then the fourth thing that we talked about, and these are part of our 3-year strategic framework for our work we're doing around homelessness, loss of hope and purpose. And it comes in 2 forms. One is collective loss of hope and purpose, or system loss of hope and purpose. So we as staff and leaders in the community, we can lose our way and begin to believe it's not possible to end homelessness and make a difference. And then that can contribute to people who've lost their homes not feeling like there are people who care about them, that believe that they can back on their feet and get back into stable housing. So collectively, we've got to instill the sense of direction and hope into our work and our relationships with folks. I'm gonna give Don a little bit of head start on some of his things. This is from the California Housing Partnership Coalition. It's a nonprofit advocacy group at the state level that periodically does some analytical work on affordability issues in communities. And what this shows is that among lower income households within Santa Cruz County, we have more than 10,000 that are spending more than 30% of their income on housing related costs. And 30% is a standard that's used at the federal level to determine what's reasonable and affordable for a household. The group that's the most likely to experience homelessness and that has the biggest challenges in our community are extremely low income households. Often these are seniors, people with disabilities, young people. And so within Santa Cruz County, that group of people living with those incomes, 75% of them are paying more than half of their income, which is considered a severe rent burden or housing cost burden. So that's the group where we really need to focus if we want to end homelessness, creating more affordable housing opportunities and resources for that population. One of the things that our state has done in partnership with our local communities, and this is a requirement that our planning departments at the city and county level establish housing elements to articulate housing goals over 8-year periods. And this chart has a lot of information on it. I just want to highlight the left of the chart so that we have time for Don to present, but it shows our jurisdictions that have housing target goals. And this is data from 2019. It's going to be updated. Well, actually it has been updated and I just haven't fixed it on my slide, but you can see the housing that we most need to address homelessness is the housing that we have been the least likely to actually create and develop. So over an 8-year period, the assigned target for us in our housing development plan is 734 units, and we're at 76 units. So we absolutely need to up our game in creating more affordable housing. I just want to put that target of 734 units in context. If you go back, if you remember that last slide, we had 10,000 households who were paying more than 30% of their income. And our goal, even with that reality, was to only create 734 units. So that means that we have a really low bar as our stated goal that we're not even meeting that. So we should not be surprised that homelessness and housing affordability and instability are such a major challenge here in our community. So some health challenges that impact people's daily living are things that we often take for granted, but being able to get dressed and go to work and earn income, being able to remember where your keys are. One reason why behavioral health or conditions of the brain, there's a correlation between those conditions and loss of housing is that when we lose some of our cognitive functioning, some of the things we need to do to keep our housing get much more difficult. I'm a big fan of the brain. It's my favorite organ in the body, but when it goes wrong, people need help to be able to retain their housing. And unfortunately, we have not done well in the field of behavioral health in addressing the needs of people in our community. The other thing that can happen is that with all of us, we may not be motivated always to get the healthcare and support we need. So our healthcare systems really need to find ways to not wait for people to come to us, but to outreach and engage people and connect them with services, ideally before the situations get so challenging that they're not able to keep their homes. Also wanted to highlight that as we have an aging population and more people with chronic health conditions that require either in-home support or a family member to provide some support for people to keep their housing, that's one set of options. But we also in California have licensed residential care facilities or assisted living facilities. There's been a statewide trend, started about 5-6 years ago with, I think, changes in state policy that raised the costs associated with operating residential care facilities for the elderly. We've seen closures and increased costs for operating those facilities. So just within Santa Cruz over the last 5 years, 11 facilities have closed. We've lost 400 beds, 9 adult residential facilities, often used by people with serious mental health or developmental disabilities, also closing. And those are factors that contribute to rising homelessness among seniors and people with disabilities that's often not talked about. This is a slide that I'm just going to go through really quickly. It essentially, at least my interpretation of it, shows that people who are experiencing homelessness often are living with friends and relatives before they end up on the street. So there's a pathway of not being able to afford your own home, you move in with others, and then you end up on the street. One of the problems with our prevention efforts and our prevention funding is that it often excludes people who are sharing a place. So if I lost my home, I couldn't afford my place, I end up living with someone else, a lot of our prevention programs won't allow me to have the extra money to pay my share of the rent. So that often means that the household where I'm staying is stressed financially with me being there and in other ways. So we've got to reorient our prevention programs to allow for those kinds of situations to be stabilized. I also found some data on K through 12 public school students in the Santa Cruz County area. And we have a high proportion of children who are living in the broader definition of homelessness, couch surfing and shelters and on the streets. So we're really trying to focus in our unit with building partnerships with the educational sector, kind of looking more upstream, particularly for families and family homelessness. This is just a reminder, both for systems and for individuals, we have to go through these stages of change, pre-contemplation, contemplation. So Randy alluded to, I think the County of Santa Cruz was in pre-contemplation for quite some time around whether it should do something for homelessness. And now we're moving into, I think we've gone from contemplation to, okay, we're preparing, we're building an infrastructure to really take some action together to prevent and end homelessness. That same process that we need to go through as a system, we often have to remember that the people we're working with have to go through those stages. And so our priorities for them aren't always their priorities. So we really got to match and listen to the people we're serving and find where they are and what's important to them. One story I love to share is about a psychologist in New York who was doing outreach to homeless people with serious mental illness. His name is Sam Sambaris. And he got really frustrated with how little impact they were having in outreaching to homeless people with serious mental illness. And he decided he would do a little survey and ask people what was the most important thing for them. And they said, I'd like a place to live. And so he said, well, they're all saying that's the most important thing, and that's not what we're doing. So we created a little pilot project to get housing for people. That's become an international model known as Housing First. It's an evidence-based practice for people with serious mental illness to get wraparound intensive services coupled with a housing voucher. It has incredible outcomes. It's been studied around the globe, and we just don't have it to scale. So it's an example of if we bring things to scale, we can really address this problem in the way that we need to. The 3-year framework that we're working under is we're about bringing a stronger collaborative coalition of people together who are committed to positive change. So moving away from blaming and shaming to, yes, we're in and we're going to work on this together and figure out how to contribute to the effort. Targeted prevention, which I alluded to, is something we really need to work on if we're going to get to the results we want. Our front door is really unclear. So if you're either at risk of losing your housing or someone experiencing homelessness, it's not really an easily detectable pathway to know where to go for help. So we've got some work to do there. But we also have to make sure that we don't just develop outreach and shelter with nowhere for people to go. So we've got to simultaneously invest in clear pathways to get people into permanent housing, what we're sometimes calling the back door on our team. And these are goals in our 3-year framework, reducing homelessness by 1/4 and unsheltered homelessness in half. We have some targets to reach in terms of number of slots of different kinds of interventions. And then globally working to support our programs and all of us to enhance our efforts and track our data over time. These are some ways that I was brainstorming that I'd love to partner with members of HIP. One is this new coalition governance board. I mentioned to Lisa that we want to have a healthcare leader represented on the new governance board that will replace the HAP, coordinating around discharge policies, SB 1152, CalAIM, which I know we're all talking about, and there's definitely some social determinants of health and housing related things we can work on. Data sharing and care coordination. We really got opportunities to improve there. Investing healthcare dollars in housing in strategic ways. Our system is built on this idea of a coordinated entry approach where we standardize how we assess people and we prioritize people based on need and available resources. So we're in the process of reevaluating that. And I know the Alliance has looked at using some models that looking at healthcare need and risk as a way to maybe prioritize limited housing resources. So we'd love to partner with you all on that. The Veterans Administration did a pilot project on living situation as a vital sign, as a way to look upstream and do prevention work. And I think that there's some real value in us. I know there's a lot of pushes for different kinds of vital signs, but I think figuring out how we can ask people about their living situation is really critical. And then linking our health services more effectively with housing. Then a couple of thought bubbles I want to leave you with, and then I'm going to introduce Don, and we'll move on to Don's talk about his work on affordable housing. During the presidential campaign, Joe Biden proposed what was by some people a shocking and radical idea that every household that was eligible for Section 8, which is an affordable housing subsidy program, should get it. And so I want to hold them to it. So I think if we all can lobby and push for that. There's some data that indicates the cost of giving every eligible family in our country or individual access to that kind of housing subsidy would be about $100 billion a year. So there's a couple ways I wanted to share with you that we could do that. Number one is if we got rid of the mortgage interest deduction and tax deduction for wealthy people like me, we could fund that. We subsidize home ownership for wealthy households in this country. If we got rid of that and moved the money over to subsidizing housing for lower income people, every low income household in the country could have this extra subsidy to help them afford housing. Another way to think about it as healthcare people is in 2018, we spent about $3.6 trillion on healthcare in our country. And if we reduced our administrative burden, which is estimated to be around a quarter of the 3.6 trillion, that's one way we could cover this gap. The other thing that researchers have pointed to is that the United States leads the world in spending per capita on healthcare, and an estimated 10% of it is due to the fact that we underinvest in education and housing and social determinants of health. So if we as healthcare people let go of some of our money invested in education and housing, we would see improvements in health status. So there's lots of ways we can get to this affordable housing gap that we need to fill. So we just have to have the political will, and each of us individually, I think, can also make decisions within our span of control to start moving our resources to get the money to people to close that gap. So I want to stop and pass this on to Don, who's going to, I think, build off of this idea of needing to invest more in affordable housing. Don and some other advocates have formed a group called Housing Santa Cruz County to really work on promoting affordable housing. Don has been a member of the HAP, a mayor in the city of Santa Cruz, a champion of affordable housing and addressing homelessness. So I'm going to turn it over to him and he can share more about their work, and then we'll open it up to questions and comments. All right. Don, you are on.
I'm here. I'm just getting ready. All right. Here we go. Am I broadcasting?
You are.
Can folks, okay, good. I just wanted to make sure could be heard. First, I want to say thank you so much to the HIPC and for inviting me to participate in this. And I also just want to really acknowledge the work that Randy and Robert have been doing in the last year to really transform the system of addressing homelessness and unsheltered people in our community. I've been working on that in this area for more than 30 years, and it's just so impressive, the shift that is taking place right now. That shift had its seeds in one of your members, Monica Martinez, who I've worked with for many years, who really, I think for the first time in this community, helped us see that addressing homelessness was not just about shelter and providing immediate services, but it always had to be about getting people into housing. And this is a trend that has been evolving slowly but surely, and now I think we're seeing it blossom under Robert's leadership. So thank you for that great work that you're doing. as you know, I'm here to talk about housing Santa Cruz County, and the other part of the work that needs to be done to partner with Robert and all the other folks working to reduce homelessness in our community. Because what we know is that knowing what to do is only half the battle. It's also engaging the community, engaging all the stakeholders, engaging local government leaders, community leaders, to push for the changes we need in order to address the housing crisis that we have. Housing Santa Cruz County, as you can see from our initial slide here, has a pretty big vision that we need everybody, all our community members, to have access to safe, stable, and affordable housing. And this is what we're just constantly working towards in our as we have formed Housing Santa Cruz County. Now this is a lot of text here, but I don't necessarily want to go over every bit, but I do want to say that we are just zeroing in on the crisis that we have. It's exacerbated by COVID, and the wildfires made our housing problem that was already off the charts even worse. And we have so many different pieces of our community that are struggling, people who are the backbone of our community. We're having, the crisis that I think we're all experiencing, if not for ourselves, at least people we know, of people really living in unsuitable conditions or having to leave. This is such a common story we hear now about people who have real roots in this community being forced out just because they can't find a place to live that they can afford. Anyway, I'm not going to go through all of this, but this is kind of the foundation of what we think at Housing Santa Cruz County is what's going on and what the environment we're working in. And I'm just going to highlight the last bullet in this, that for our purposes, more members of our community need to be informed and engaged on the critical need for affordable housing. Obviously, you all are really tuned into that critical need in relation to the social determinants of health, that this is a foundational need that people have. If they don't have that housing foundation, a lot of other things go wrong. And so we need to just keep talking about what needs to be done, getting more and more people on board. And so what are we going to do? What do we need to do? Housing Santa Cruz County was formed to do these things. We're going to advocate. We're going to advance the ideas that need to be understood in the community. We're going to support policies, projects, things that are out there that we know can be implemented if there's enough support out in the community. We have to do education because there's I'll just use an example. Permanent supportive housing is such a key element of addressing the housing problem for people who are on the streets right now who aren't going to make it just independently on their own. But people don't necessarily understand that this is such a successful approach to addressing one piece of homelessness. And so we need to help people understand in the community how valuable this would be. And we talk about influence because we feel like there's leaders in the community. You are among them, the HIPC, who we need to keep talking to about just how we can get housing done in Santa Cruz County. So just to give you an example of what the kind of work we're going to do that has a lot to do with education in the community. As Elisa noted earlier, it's Affordable Housing Month right now. Housing Santa Cruz County assembled a couple of events of our own and then also reached out to many other housing interested groups to put on community programs or events for in the month of May to make, to start filling people in on what's going on, what's going on with accessory dwelling units, what's going on with the housing elements that Robert referred to that kind of create an underpinning of opportunity in our local jurisdictions, so that we'll have more sites to build affordable housing. So the slide here particularly emphasizes one event that we're putting together for next week. I'd like to invite y'all to come, but it's partly up here just to give you an example of the kind of work we're trying to do. We've invited all the jurisdictions leaders, 3 mayors, 1 vice mayor, and the chair of the board of supervisors to come speak to us and the community about what are they going to do about affordable housing, to put their cards on the table, so to speak. And then part of our work is going to be to really make note of what they say they're going to do. And then next year, go back to them and say, did you do it? Did you build more housing? Did you change policies that are going to bring us housing? So part of our work is going to be about, engaging with elected officials and then holding them accountable, but not in a harsh way, but just kind of reminding them, you've said you're going to address this issue. There are tools you have to address this issue. Are you really doing it? Are you delivering for the people in our community? So a little bit, this is a little bit more detailed than you may want to know today, but we're a fairly new organization, but we're trying to kind of map out what we're trying to do as an organization, what we're going to promote. And the key thing is that we think that we need policies that are going to deliver housing to the lower end of our economic spectrum. That's really the heart of our work. We do believe in general that more housing has value, but if we don't target it to people at the lower end of the economic scale, we're not going to get the results we need. We also want to make sure that we're preserving current housing, that specific projects are getting approved, that really emphasize, again, serving that population. We're going to, especially, there's some projects are going to have some affordable units in them. Some are going to be 100% affordable. We're going to be particularly interested in projects that have 100% affordability. We're going to be particularly interested in projects that are geared to truly vulnerable populations, such as seniors and farm workers, people with disabilities, and people who are coming out of homelessness. So next, I put this slide up partly because this Caratina made a presentation by video to our launch event a few months ago when we formed Housing Santa Cruz County, but I also wanted to emphasize that it's so important that we think about housing and affordable housing not as about buildings, but as about a place where human beings live. I think this is such a difficult, in a political environment like Santa Cruz County, the battles about housing often become a battle about a building or about a development and those kind of words. And I think we have to remind people over and over again, no, this is about families. This is about senior citizens. This is about homeless people who are living on the street. And that's the thing we're addressing when we promote affordable housing. We try and stay focused on the people, not the buildings. So last, in a way, this slide might have been called Who We Are, but I do want to tell you just a quick bit about our history, if you will. We formed out of the Measure H housing bond campaign, but it took us a while to get our act together, partly because the pandemic got in the way. But the same folks who worked on that issue created an informal steering committee, and we said, let's start Housing Santa Cruz County. And then late last year, we kind of became a real organization with a fiscal sponsor. And then literally in just 3 months ago, we launched publicly. So we're very new. And we are right now in the process of transitioning from a sort of a working group, founding working group, to a real governing board that is truly going to represent the diversity of our county in terms of geography, ethnicity, and race and gender. So we are going, we're about to sort of shift into a higher gear. We're about to hire our first professional staff person. And we really are aiming to have an impact on this issue because the time is right. Everybody knows we need to do this. And there's lots of groups working on affordable housing, but it is not all come together under one roof. And that's what Housing Santa Cruz County is trying to do, is to bring all the groups together. And we've been very successful thus far. We've got about 35 organizations having joined us and over 100 individual members. In fact, I think there's about 6 or 7 of the HIPC members who are represented on this in this meeting are in various stages of joining or considering joining Housing Santa Cruz County. Elisa has very generously offered to help us with governance, at least for our first year. So we are just getting going, built for impact. And that's what this is all about. Robert has, I think, so articulately laid out what we need to do, what the need is and what we need to do. Housing Santa Cruz County is here because it's not going to be sufficient to have the right plan and the right ideas. It's going to take advocacy and action and mobilizing people, bringing the community together to demand that we solve this problem of our lack of affordable housing. So with that, I will stop and just say we invite each of you to consider joining us. Keisha from the United Way may know this, that a few years ago, one of the greatest honors I ever received was that the United Way selected me as Advocate of the Year. And I feel like that is a great badge to have. I'm here to promote this work, to promote what Robert's doing, to promote affordable housing. That's what Housing Santa Cruz County is all about. And I'm not doing my job as an advocate if I don't say, please join us in this work. And with that, thanks so much for inviting me to participate.
Thank you, Don and Dr. Ratner. We have about 10 minutes if there are questions about the content that we've just heard. And so I'm going to open up my screen so I can see people, and feel free to just unmute yourself or raise a hand if you had a question or a comment that you wanted to share. I suspect people are digesting because that was really rich content and super thought-provoking.
Stephanie,
on our place. Yes.
This is Randy. I'm going to use the pause to invite the subject matter expertise of those of you who are participants in this health safety net. Robert is a health expert. Grew up in human services. One of the things Robert didn't have time to get to is we are committed to having better data, and we're committed to transparency. And so when Robert showed that slide of where we are from pre-contemplative to planning, we are building our data systems and we are building our processes to better share information. And not for dialogue, we don't have time, but kind of following on Don's invite, we also invite thoughts to us about what the right type of data, what questions we want to have. This is a very complex issue, and people end up going down rabbit holes of complex issues, and we don't have a good story to tell that's simple, that's built on data. And I just really invite any help in our efforts to kind of create a story built on data as we work together to create those data systems. So between now and as we're whatever that stage, Robert, we go to next is, the cement is not dry in how we're building up our data systems right now and how we tell those stories. So we really invite your thoughts. We would benefit from your thoughts.
can't find the raise hand button. Hi, everybody. I just want to thank you so much for this presentation, Dr. Ratner and Dawn. It is so refreshing and energizing as somebody who's been working in this work for many years to see the vision and to see the organization and to see the data. And it truly feels like we're in a place where we can collaborate with a shared understanding about the impact that housing has on overall health of our population and of our community. It feels like we're not in a place where we need to convince people of that anymore. We just need to go now and do it. And that is such a milestone that I want to recognize and appreciate. And I'm so behind your energy and your efforts, and want to be there to help in any way that I can. And I hope I can speak for other members of HIP in that we are so grateful for this work and want to be involved.
Thanks for helping to get us to this moment, Monica. Years of advocacy and work.
I'll just say thank you so much. I haven't met you yet in person, Robert, but I just am so, yeah, I'll echo Monica's words. I mean, this is such a heated, difficult topic for our community, and it raises a lot of people's fears on so many levels. And I think, thank you for naming stigma. Thank you for, going into the difficult areas. And this is really something we can only accomplish by working together. So I think we've got a lot of work ahead. This is going to be really hard, but just thrilled that we're finally here to try to truly change this. It's not easy. Thank you for your work.
I didn't mention it, but many of you saw in the press that the governor announced $12 billion to go to homelessness. So the more that we're organized and prepared with potential housing projects and ideas about how we can tighten our work together, the more likely we are to get that money. So look forward to working with you all in the next few months. We don't have to wait long to bring in some new resources. It's coming.
So I'll just echo the appreciation for the presentation and the leadership, because as people have alluded to, this is one of those complicated issues in healthcare where there's so many facets of the problem that have to be addressed to solve it. And so I find myself in that kind of demotivated space because it can be a little overwhelming. And so thank you for naming that and letting us that feel that own it. And then really thanks to those that are expressing enthusiasm and appreciation and a feeling of empowerment, because it's encouraging to see that people are receiving the same content and thinking we can do this because it's so important. So just a lot of appreciation for everybody here in that. I know from the Alliance's perspective, we're digging deep with the county on the transition of whole person care into CalAIM. And I know there's meetings actually happening this week with you, Dr. Ratner, and the Alliance team. And so really excited that we're going to be kicking off those discussions about how do we leverage what the state is making available to support these efforts. And so just want to make sure that I'm indicating the Alliance's commitment to working in partnership with the county and with others in the community that are wanting to ensure that our members have access to stable housing. It's really important. So just thank you for that and look forward to the ongoing work. Just looking at the screen to see if there's other questions or comments or thoughts, opportunities for connection outside of this meeting to advance the work.
I just have a quick question about, I guess, upcoming policy issues that would be impactful to this work. And I guess specifically general plan amendments, or I understand that the county may be at kind of a time where they're looking at that again and what impact that might have in how we can develop future housing.
Yeah, Dawn can chime in too. So I think number one is we still have the current housing element in the goals. So I think holding all of us accountable for achieving the goals, particularly for the lowest income people in our community, is one thing we can do right now. And then I think planning for what those goals are going to be for the next 8-year cycle and raising awareness of the importance of really having targets that are more fitting for the need. Often what happens in these negotiations, the low income targets are set very low and we don't even meet those. So I think just bringing a unique healthcare voice to those planning and housing tables, frankly, would be a radical transformation. Most of the people who show up at those meetings are folks in the kind of housing industry, and there isn't a broader lens on the impact of housing on health. So showing up in those conversations, being more on the side of, I'm not a huge fan of this, but it's YIMBY. Yes, we want to do more housing. Having that group show up at the table makes a huge difference. So I really appreciate Dawn and the new group trying to organize and mobilize us to do that. So I think it's a combination of holding us accountable to our current goals and articulating ones that are really more fitting for what the need is in the community in the next round.
Elisa, I'd like to piggyback in a very concrete way. I think there are going to be at least 3 forums that will play out multiple times in the years ahead where elected officials and decision makers have choices to make. And I think if we achieve our goal of transparency and coalition building, we can figure out with HIP how to make sure everybody on HIP is aware. So number one, Robert mentioned it in his presentation that we're looking to repurpose and reorganize this governing body called COC at the federal level, HAP locally, and having a nexus with HIP to have the health voice, is a place. Money comes in, decisions get made about how to purpose and triage. And then number 2 and number 3, which are one and the same, are county board meetings and city council meetings. There will likely be choices to be made. Robert and I, as county employees, will lift up and bring forward to the county elected opportunities and decisions, and we will work with city managers for city council decisions. So I think same thing, if we achieve what we're trying to achieve is like be public servants who are working in partnership in a democracy, this should be open and transparent, informative, and these should be rubber stamp coalition votes at these places, but we have a lot of work to do to get there. So really invite HIP formally and members of HIP to sort of join in and plug in. And Robert and my role, and I think goal, is to be transparent, open, and share with everyone when these moments are happening. I think I have experienced these have been black box moments where people don't quite know where decisions are getting made, and it's a mystery, and it generates more frustration. And we want to get out of that role. So we're working on that. I hope that's responsive, Elisa, but stay tuned.
If I could chime in also, what Elisa pointed out about, for instance, general plans and zoning and the housing element work that's coming up. These are all kind of the esoteric items that most people don't engage in. They tend to move when there's a specific project, but the foundation of success in this work is going to be finding sites. Let's just put it in its simplest terms. We see that just over and over again, both in terms of homelessness, kind of these homelessness emergencies. We say, where do people go? That's replicated in the affordable housing work too. It's like, where are we going to put the housing? It is the classic situation of not in my backyard. People say, yes, we need more affordable housing, but don't put it next to me. And we have to try and shift the conversation so that local jurisdictions are doing planning, general plans, zoning rules that say, we are going to find lots of sites throughout our communities that are going to be the places where apartments are going to get built. And that is, the work is in mobilizing people to say yes. As Robert said, YIMBY is sometimes that term is not always used very well, but I think we want at least that positivity. Our neighbors need places to live. And if you don't want some of those neighbors to be living on the sidewalk in front of your house, then have an apartment down the street from you for them to live in.
Okay, I think we've had a call to action today to think about what we can do further collectively together. The presentations will get sent out so people will be able to connect with Dawn and Dr. Ratner and Randy after this meeting, should there be additional thoughts and discussions. I'm going to move us because we have 2 minutes until 9 and I want to be respectful of people's time. So I don't think we have time for additional partner announcements. Just looking to Elisa, who seems to be okay with that for now. So thank you so much, everybody, for your time and attention. Our next meeting is on June 10th. So we will see each other, if not before then, on June 10th. Thank you so much.
Thank you so much.